No, this individual is in isolation outside of the hospital.
And this individual's condition?
Stable.
How long has the person been in the hospital?
Just that amount of time that required to be evaluated.
From 11:37 to about 2:30 a.m.
Are you asking any other individuals who've had contact with this individual to social distance, or what about the folks at work? Did he go to work?
So those are things that are currently being investigated right now. So as we do this individual's evaluation, Marion County Health Department will be taking the lead on that, and those are the questions. You know, what flight did you fly in on is very important. Where were you staying? Who did you have contact with? Did you go to school? Are there children or other individuals in the home that could have been exposed? And those are the things that Marion County Health Department will be following up on very closely.
Is the patient in Boston on business at the conference or there for personal reasons?
Was associated with a conference out there, did not go to the conference, but is a contractor that works closely.
How long was he in Indiana for after his trip to Boston?
Individual returned to Indianapolis on the 4th, Wednesday the 4th.
Did he expose any of his family members?
That is still being under investigation at this point in time. So we at the State Department of Health have tested a total of 12 individuals at this time, and we are monitoring about 35 individuals. But they are all quarantined. They are none of them sick. The only positive test we've had is the one we are telling you about today.
Who does the patient work for?
I don't normally give out that kind of private information about an individual.
Is he at home right now or still in the hospital?
Not in the hospital, but under isolation. He is just in self-isolation at this point in time.
You said you tested 12. Is that total, or is that 12 in relationship to this specific?
No, there's 12 total so far.
Since the beginning of January, or whatever, yeah.
Well, and some that the CDC did for us also.
Right.
But we have had the testing ability since Saturday, this past Saturday.
The President signed an $8 billion COVID-19 aid package. What does the state want? What do you need from the federal government at this point? What does Indiana need?
So we are going to need additional what we call epidemiologists to be able to go out and to investigate these cases and to follow up and trace contacts with this. We will need more masks for individuals that are isolating at home. We will need to be able to have the ability to follow them up and to do lab testing to confirm that they are now free of the virus before they can stop being under isolation. We need resources with regards to a call center because our call center is very, very busy right now taking questions not only from providers across the state, but also just from kind of the worried Hoosiers across the state that want to ask questions. So we're going to try to split that up a little bit and divide and conquer. Jenny will need some resources for our local health departments. Are there other
So
things?
we may need costs for like when you're quarantining someone and you have to isolate them, paying that financial cost that's associated with that. And we'll have to have a lot of outreach, and we have to have daily monitoring of individuals that we are monitoring. Daily contact, sorry.
To be clear, the patient is not in the hospital right now.
That is correct. As I said, 80 to 85% of these cases are mild cases. So many people do not get hospitalized with this.
How would you classify this case?
As a mild case at this point in time. There was nothing that indicated this individual needed to be hospitalized.
What is your biggest concern? We don't like to use the word fear.
Mm-hmm.
But you go to bed at night, you have a moment to think. What is your biggest concern at this point?
Well, I think that we have seen that the majority of deaths in the United States have occurred because there was a long-term care facility that got the COVID-19 infection, and that is our highest risk individuals. They're usually individuals that are quite elderly, over 65, and individuals that have underlying health conditions. So the messaging out there should be, if you are ill, if you are at high risk, if you've been exposed to COVID-19, if you have been in any of these countries or even states that have a high percentage of cases, I would not recommend visiting the long-term care facilities right now. And we're getting that messaging out there to all the long-term care facilities.
As far as you know, is the patient on any special medications?
No, this individual is actually pretty healthy, so we're blessed for that.
This is Dr. Kane, a follow-up question. I'm sure that folks will be concerned when they hear that there's a person in our community. Are you planning to do a follow-up today to let folks know, what is sort of your time frame of getting the word out about potential contacts of this one?
So we're hoping that because all of you guys are here and we have such great attention from the media, that this initial message will be really critical to getting out to the public. But this case is fluid, so based on any new additional information that comes out, we will dictate further information coming out related to that. So I can't tell you now. I'm going to do a press conference this afternoon further than from this.
But what I'm asking is, we're being told that testing is being done priority for folks who've had contact with someone.
Yes, so as
But I have no way of knowing at this point.
so just remember, he was in that emergency room at that hospital at 2:00 in the morning, and they called their folks from home to do the laboratory tests for this coronavirus. So we had an answer this morning related to that. So we're going to do our investigation, and if we have any additional cases, we will definitely continue to be transparent and release that information. Okay. But hey, my biggest concern, I need the public to be patriotic and do the things they need to do to protect themselves. And I want them to take this virus very seriously, but you can die just as well from the flu, influenza. So we want people to do the practice things that they need to do to protect everyone, and please follow our guidance.
Dr. Ullett, you talked about you taking steps, you've done advanced planning for events of this kind. Can you just elaborate a little bit more on the planning you've done and how long ago that started and what it involved?
So all hospitals have disaster plans. So we've had for many years an infectious disease code internal disaster plan. We've activated before we had Ebola back in 2014. And so there's emergency preparedness for all kinds of scenarios, whether it be one individual, multiple individuals, multiple sites, ambulatory sites, ED. So we've opened that up and we refreshed that. And so we have about a staff of 25 to 30 people that meet on a daily basis and have been for a number of days to address all the different scenarios for potential. So are we covering every single possible scenario? Probably not, but that's the reason we meet regularly, and we have had these plans in place. All citywide hospitals do this on a regular basis.
And they have to practice it at least minimum once a year, where they do an actual practice based on a scenario that they think. So it's just not we're prepared. We actually practice.
But how much, you talk about an isolation room, how much capacity do you have for isolation space for additional cases?
So that's what we need to be judicious. All of our emergency rooms and all our hospitals have these isolation rooms, these negative airflow rooms. We have several at every institution. At some point, we may reach a capacity, so we actually are doing disaster planning where we may need to isolate specific wings of a hospital or do other potential ways of increasing capacity. Right now, we have ample isolation, but if it indeed becomes significant, we have disaster plans in place, again, for different wings or other options at all the hospital sites. And again, I want to reiterate that every hospital has these same contingency plans. Will we ever be completely prepared? Probably not, but we're trying to stay several steps ahead of the game.
Hi, thank you all so much for coming. We're going to cut this off now, but we will have a release from the State Health Department coming out shortly. Thanks so much.